Well, guess what? The holidays can be a stressful time for both you physically and emotionally. This time of year is especially hard on the heart.
Cardiovascular disease specialist Dr. Nidhi Kumar is on call this morning with advice on how to stay heart healthy all season long. Good morning to you.
Good morning.
So, Doc, why are the holidays such a stress around the heart?
Yeah, I mean, this can actually be a very stressful time emotionally and physically. You know, we start at Thanksgiving and then we kick off the next 6 weeks.
Yeah.
We are overindulging. We are skipping sleep and exercise. And for a lot of people, they're experiencing high amounts of emotional stress. And these effects are very real. We actually see an increase of 5% of cardiac events and cardiac death during the holidays. I mean, I don't mean to sound like the Grinch, but this is a real thing.
So what kind of physical effects are you actually seeing on the heart specifically at this time of year?
Yeah, so in the medical community, the first thing that we see most commonly is uncontrolled blood pressure. See, we're creatures of habit. So one thing about this time of year is we are off of our schedules, we're off of our routines, and sometimes that means we're off of our meds. People skip their medications, they're eating high salt foods. The combination is the perfect storm to make your blood pressure go out of control. Now, this is preventable. Be mindful of your salt, and if you take medications chronically, set an alarm right now on your phone. So that way, no matter where you are, no matter what you're doing, you'll have that cue to take your meds every day. The second thing that we see is something called holiday heart syndrome. We actually have an illness named after the holidays because we see it commonly during the holidays, and that is an electrical disturbance in the heart that causes an arrhythmia, and it's related to alcohol use, which is something that flows a lot during the holidays. And this is something we see in people that have no history of heart disease, no risk factors for heart disease, and that's because alcohol can actually be toxic to the heart at high doses. Again, this is preventable. Holiday heart syndrome is caused by binge drinking. The CDC defines binge drinking as 5 drinks in one setting for men, 4 drinks in one setting for women. So you want to be very mindful of your alcohol use. And I always say to people, try employing an alternating strategy. So you have one alcoholic beverage and then one non-alcoholic beverage. So by the end of the night, your total alcohol consumption is significantly lower. And the third thing that we see is exacerbation of existing heart disease. So people have pre-existing disease, and then it gets a little worse during this holiday period, most commonly in patients that have congestive heart failure. 5 million Americans are living with congestive heart failure, and these people live in a very delicate balance. So when they take in a lot more salt during the holidays, they retain fluid, and they can get sick, even get hospitalized. Again, this is preventable. Be mindful of your salt. See if you're a candidate for using a salt substitute when you cook. Not everybody is, but many people can. And then finally, I suggest that people that have congestive heart failure weigh themselves every day. If you notice that your weight is increasing rapidly from one day to the next, it means that you're possibly retaining fluid. It's an early sign that you are having worsening disease. You can call your healthcare provider, and they can make adjustments over the phone.
So you also talk about this time being stressful emotionally for patients. So what do you tell them to combat that? So
it is absolutely a stressful time for people, especially if people are experiencing loss. There's a lot of sadness, and you know, when people experience depressive symptoms, there's an interplay, right, between your emotional heart and your physical heart. And people that experience these symptoms have a 20% greater chance of having a cardiac event. And it's hard to talk yourself out of feeling sad. So what I say, the easiest way to elevate your mood is actually to help others. So try to find a charity, try to find a way to serve others, because altruistic actions actually make us happier. When we do for others, we activate the centers in our brain that are the reward centers. We release those neurochemicals, the oxytocin, the serotonin, the dopamine, the happy hormones.
All right, Dr. Kumar, thank you so much. That's great advice for us for this time of year. We really appreciate it.
Thanks, Doc. Good to see you.
Take care.